I'm Julie Posetti, ICFJ's Global Director of Research. I'm joining you from Oxford for another Global Health Crisis Reporting Forum webinar. Today's theme is journalism safety on the front line, how to protect yourself while you're covering COVID. One point I want to draw your attention to up front is a point made by a UK government minister who said that journalism and news organisations, trusted ones, are in fact like a fourth emergency service during the COVID-19 pandemic, which I think is a really interesting way to frame the work that we do and the work of those that support us, reporting on a crisis of this magnitude. Because we provide independent, verifiable information to the public, the role that we do can be described really as the role of key workers, and in many countries around the world that's how we're being defined, and being given permissions to be literally on the front line, physically in some instances, and certainly on the front line vicariously, if you like, accessing information and images and experiences digitally that are also a lot to bear. And so we are going to delve into some of those issues today. Mostly because journalists are risking their own health and safety every day as they try to bring you accurate, reliable information, which has really never been more important. This is a matter, of course, of life and death. So those of us who are deemed to be an essential service are still either working in the field or remotely for newsrooms that are operating virtually. And we're finding ourselves increasingly on the front line, not just because of the physical risk and the risk of the psychological trauma, but also because those risks are being exacerbated via political attack and politicized attacks on journalists. So we're going to consider these issues in that context as well. So how can journalists protect themselves physically, psychologically, and digitally while reporting on this crisis? And what should news organizations and other employers be doing to try to support them? We also want to have a think about what the long-term effects of this experience might be as this crisis goes on, and how we can prepare for that now. So today we're joined by renowned Egyptian journalist and journalism safety trainer, also an author on the theme of journalism safety, Abeer Saady, who's joining us from Berlin, and the Dart Centre's Asia Pacific Director, Dr. Cait McMahon, who, while being a qualified psychologist and a veteran director associated with the Dart Institute, also has a PhD on these very issues of dealing with journalists experiencing trauma. So we're well served for a discussion to try and explore these issues and to surface some really practical advice that we can begin implementing almost immediately. So Abeer, I want to go to you first, but before I do, I just want to say to all of those who are joining this webinar remotely from around the world, we have 2,500 plus members of our ICFJ Health Crisis Reporting Forum, and many of them have expressed interest in this, and they're going to be sharing their questions with us during this webinar, so we'll try to take as many as we can. But Abeer, you, while being based in Berlin, have spent a good chunk of your career as a journalist working in the Middle East. You're originally from Egypt, and now you find yourself being a support service, if you like, for journalists, particularly Arabic-speaking journalists who are experiencing all manner of safety concerns and risks associated with covering COVID-19. So you're engaged in a range of different forums to do this. Can you just share with us a bit about what you're learning now as this crisis unfolds about the kind of most concerning, I suppose, or most urgent physical safety risks to start with?
Yeah, first of all, thank you, Julia, and thank you for organizing this webinar, for everyone who have been make it up here. We're living very difficult times, but I mean, now we cannot say that this is a new thing because we have been experiencing, and the experience we get is increasing day by day, which is, I think, the positive part of this pandemic. Some countries and some journalists in some countries that I've been training with different partners like International Association of Women in Radio and Television in the Philippines and Nepal are more experienced in dealing with crisis that's related to nature or something biological. Some others are related more into war, but it is a lot of similarities that I keep hearing, for example, from my colleagues in Syria and Iraq with war. And the issue is that this virus is everywhere. The good thing here is that it starts somewhere, like it started in Asia and China in particular, and then come to Europe, and then now it's coming to Africa and the Middle East, which increase the learning process among the journalists. The most fears are, of course, because it's an infection, because journalists don't want to, they are on the front line. I mean, like doctors are in the front line, but like journalists, could journalists try to go there? Problem is when they try to go in the field, it doesn't only endanger them, it endangers their families. And I'm not able to name, but I know in a personal level, around 7 or 8 journalists that I know was infected. And one of them got it to her child. And they were both cured now, which is luckily, no one is in a serious condition. So infection is the issue, the first thing. The other thing, they are not equipped enough. They are less equipped to go and do this. And if they are equipped, some countries don't have the same professional protection like other countries. And we hear about stories about big infections happening in hospitals in some countries, which increase the issue. They keep on all the time, they see the Western journalists easily going to the hospitals, they are very well prepared, they know things are going right. But you see on the other side that if infections happen within the hospital itself, within the doctors itself, I mean, I keep convincing them that if you are not like really sure you're going to be okay, that will be influencing you. The journalists who are staying at home, this is another dilemma. I think Dr. Cait will speak a lot about that, but I tell you, it's a lot of depression. It's a lot of worry about the family for both those who go outside and those who stay. It's a lot of worry about their financial issue, because I think this is a big issue. And this really influences them. And we can reach to the point that some people are really on the fence. I mean, to take other procedures with depression. But protection means as well, a lot of journalists now are really are losing their jobs. If they are freelancers, a lot of contracts are terminated. If they are in work, they are pushed to go to the field, which is really endangering their life. And you have to really convince them and to give them some logic to stay at home and stay safe, or just keep more safety in this process.
And we have the added, yes, you make a very important point that in most cases, at least, journalists are not medical practitioners intervening, you know, trying to intubate patients, of course, which is the highest level of risk. But they are called through a vocation to actually ensure that these stories are being told. And it's not just journalists in the global south who are struggling to get the appropriate personal protective equipment, of course. I mean, I think we're seeing examples of that in Western contexts as well, where there are shortages of such equipment, even for medical workers. So those are really important points you make, linking the economic, psychological and physical risks. And we will come back to explore some of those physical risks, particularly in more detail with you, Abeer. But Cait, to pick up on the points that Abeer made just then about the sort of psychological pressures from the work that you do and you're continuing to do in the context of COVID-19, can you share with us at this point what you think are the most critical issues or concerns that journalists are facing in terms of their psychological health? I mean, we can certainly correlate the loss of jobs. You know, we're seeing an industry under enormous pressure and people being put out of work. So there's an additional feature to this risk that we're facing at the moment. But from your perspective, what are those critical issues?
Yes, look, thank you. And thank you too, Julie, for providing this forum tonight. Look, I think Abeer is right. We're seeing much higher rates of anxiety and depression, I think fear as well, and high rates of grief, which is, you know, is quite different to going out to wars, I think, in a way. You mentioned about the similarity of a war zone. But I think the fact that this is all pervasive, that we are all experiencing this. I keep saying that we are all, we're all in the same storm, but not necessarily in the same boat. We experience this in different ways. Of course, you know, journalists that are losing their jobs are experiencing a whole different realm of issues compared to people that are still working as staffers. I think that what I'm hearing, and Abeer had already noted this, that the high concern for family and infecting other people, that is really acute amongst many journalists that I'm talking to, that there's a lot of distress around the possibility. I know a couple of journalists in Europe that believe they have already infected people by being out and reporting. So there's and because it's so unseen, you never know when you're going to get this or pass it on. So there's much higher rates of distress, of anxiety, depression than I've seen before in any other, you know, when people were reporting on the tsunami and whatever. So look, I think that they're the main ones that are coming up. And of course, because journalists are experiencing this like we all are, there's this difficulty of boundaries. When reporting on the story, it's like, well, I'm also in this, and the people that I'm reporting on are in this. So what might I be projecting into the story of my own anxiety or distress? So that's very different than what has ever happened before. So they're the main things that I'm seeing that are heightened, that are different.
It's fascinating and disturbing, you know, to hear you actually say already that you can see that this is worse, you know, more worrying, and there's evidence of greater anxiety, and I think you said depression and fear. And I'm not a psychologist, but I would add guilt to that as well. And I don't know if that feeds the psychological risk, but I think, you know, people feeling guilty about potentially transferring the virus, but also just the sense of helplessness with that invisible enemy. So yes, I mean, you just encapsulated what I've certainly been hearing, and others in these networks have been hearing as well, Cait, really effectively.
Yeah.
So we'll move on to perhaps thinking about how we can identify these risks. I mean, we've named some of them, which is, I think, really helpful, but how we can then think about responding. But Abeer, just back to you for a moment. I mean, in addition to the risk of being infected by the virus and the need that you've outlined to access appropriate protective equipment and practice, you know, safe physical distancing, which is the term being used in the West, you know, to ensure that you're not in the vicinity of somebody who might be affected, or you're wearing the appropriate equipment. But beyond that, and you made, the important point, of course, that you should not sacrifice your safety to go into the high risk zone if you can't access the appropriate equipment for a start, or you should, you know, try and work remotely despite the risk of economic impacts. But there's also another risk, which is physical and probably psychological, and that risk is the attacks we're seeing on journalists. Now, at the last minute, I checked prior to coming on air with our webinar, I checked the tracker that the International Press Institute is using to monitor attacks on journalists connected to the COVID-19 crisis. And they have about 36, I think, identified attacks on journalists around the world reporting on this incident. Now, those attacks are a combination of verbal attacks and physical attacks. But the physical attacks we've seen have included journalists being physically assaulted because they are perceived to be themselves vectors of the disease by citizens. But they also include physical attacks that are driven by political demonization of journalists as, you know, fake news, which is, of course, a highly problematic, politically motivated form of abuse against journalists. Are you seeing anything in terms of your discussions with colleagues about that, Abeer? And do you have any examples you can share with us to perhaps shed light on how this is playing out globally?
It's an opportunity, of course, for oppressing systems. We know there is a lot of oppressing regimes, and this is a golden opportunity. We have sometimes colleagues who are already in prison, you know, without any charge, and we want to free them during this. So already there are some of them, and lately I think in some countries they are sentenced to be terrorists, which is something you cannot defend yourself against, you know, because they are thinking always, if you accuse journalists of being a terrorist, and in some countries, like for example, like the Philippines, a drug dealer, or the Mexico, you cannot defend yourself. So they are seizing the opportunities. This is number one, and it is happening in different countries. Number two, as well, is the lack of information and the lack of transparency. Already, you know, this disease, this COVID-19 is a revealing thing. It reveals a lot of systems, a lot of regimes in different contexts, and in those oppressing systems, you have to take what the government is giving you. And at the end of the day, you see people in your own circle getting COVID-19, and you still see the figures are very different. So you don't know what is the reality about that. And those journalists are threatened. And let's always here not only speak about journalists as a whistleblowers, we have as well the bloggers and everyone who has a camera.
Yeah.
Those time. And I know like a lot of cases, because, you know, when I studied in my master's, I had a lot of Chinese colleagues, and I know it was not only the doctor who was taken. There are other people who were taken as well, and these things as well. If you don't get those information right, then you are going to be accused by having fake news. That's a big issue. And I think we are going to discuss it more afterwards, because there are a lot of rumors already. And if you as a journalist don't have answers, people to answer that, that's a big issue. The journalists are accused of making this. The last thing is the stigma of the disease itself. This is the big issue, especially in some communities. I don't want to say like the West, or we see now it happens everywhere. So like first we have seen people clapping for the doctor, but we see people who are dismissing people who are in the medical care center. They don't want them to live in their building. This is started to happen with some journalists as well. Yes. You know, ministries give journalists the right to stay in some hospitals because if they are following this, and when they go home, they face the same like the doctors and the nurses.
So those are physical impacts as well, not just violent attacks and verbal attacks, but also physical attacks in the form of kind of ejecting them from their place of living, or their place of worship, or their place of, you know, whatever their community is where they're occupying. Cait, can you follow up on that, perhaps with the reflection on the psychological ramifications of journalists, you know, being online abuse against journalists was a well acknowledged problem, particularly regarding women already prior to this crisis, through work that we're doing with UNESCO and ICFJ and other colleagues, and DART and Abeer, you're in fact involved as advisors on that project, which will kick back into gear, we hope, once we pass the immediate crest of this horrible experience of COVID-19. But we already knew that was an issue. With COVID, we're seeing an increase in some of those attacks on journalists. So from a psychological protection and defense perspective, even just the incidence of that, Cait, are you also hearing of increased concerns about abuse, whether that's coming from a political leader in one of the countries that you're dealing in, or coming from mobs online, for example?
Yeah, look, that's certainly on the rise and has risen, Julie. There's no question about that, and I'm certainly hearing that around the place. I think one of the things that I've been speaking with journalists about what to do is that if they haven't even yet been attacked, many have been, and I've been discussing that with them about the impacts of that, but is to plan as if you are going to be attacked. To be forewarned is to be prepared, I think, is to plan what you will do if you are attacked, or to share that with your colleagues. So to get together with colleagues. I mean, journalists are very good at coming together online, and that's been, you know, that's something that's as a support, as a peer group, that's been happening before COVID. But I think now with COVID, we're all much more digitally adept. I've never used so many Zoom webinars as in my life. And so that's a skill that journalists already have, the ability to connect up in the digital world. And I think to be able to create these sorts of peer group supports, especially whether it be like-minded or whether it's gender-based groups, women getting together, women journalists getting together, to check in with each other, to see how they're going, to check if anyone is being attacked and what they may be able to do to combat that, whether it's journalists in a geographic location getting together. So I think the social support when people are being attacked is really, really important. And we're seeing that isolation is a big part of this disease, that we're being forced to physically isolate. So the more that we can stay connected, socially connected, it's very, very important. Certainly the attacks are on the rise, and I'm certainly hearing that.
Is there a risk too, Cait, that because so much of this this pandemic, this is physical, you know, the concerns that we have, that we tend to downgrade, particularly as journalists, you know, we all know this is a habit that we have to kind of, you know, de-emphasize, if you like, the experience of psychological effects and injury that come from reporting on these sorts of crises. Is that even more of a risk in terms of dealing with the potential psychological impacts of this disease?
Look, I think it is. And I think, you know, time and time again over the years, I hear journalists say, look, I have no right to feel distressed or anxious because it's not my story. You know, I'm just reporting on this. I'm the witness here, and I don't have a right to be impacted. But what we know is with vicarious trauma, we're all potentially impacted, and especially with this disease where, as I said, we're all in the same storm. So I think, yes, journalists do downplay this, but there is this underlying anxiety just across the globe. I'm certainly, just as a normal human being, not as a psychologist, feeling more anxiety than I have before. You know, I go out shopping and I don't know if I'm going to be bringing back the disease to the house. So I think the important thing, I think you said earlier, Julia, it's really important to acknowledge that there are these feelings around. They're very real feelings. You're not weak. You're not a weak journo if you do feel more distress. So the first thing to do is to just acknowledge that it is okay to feel these things. They are there. There's no negativity to feeling anxiety or depression. It just is. It is just your reaction, your response at the time. Just as if you break your leg at work, to feel emotional reactions when you're at work is just the same sort of thing. It's not a moral weakness to feel emotion. In fact, it's pro-social. It means that we are human. It's how we're programmed.
I imagine there's a gender element to this too, that when we're dealing with journalists, we of course are aware that as three women discussing this issue, and I'm going to come to our audience members very soon, many of whom are also women, we tend to downplay our experiences, partly because we have to project an image of toughness just to be journalists, and we tend to, you know, mitigate emotional responses to things. So what I'm hearing you say, Cait, I think is it's important to acknowledge those emotions and to express them. Is that fair? And
look, yes. Sorry, I'll cut you off. Yeah.
No, that's okay. But what would you what would you say? I don't want to just kind of pluck around a number from the air, but I will. What would say the three things you would suggest if people are feeling as you've just described, like overwhelmed and seriously anxious and depressed? I'll come to you in a second, Abeer, but Cait, just from a professional perspective in managing these psychological issues, what three steps would you recommend people take?
Look, I think the first thing is we know that the research tells us that social support is the thing that enhances resilience. That's the thing that is the biggest buffer against erosion of our mental health. So reaching out to your colleagues. I've been hearing about journalists, especially freelancers and a lot of women who are working on their own, living alone, and so not working in the field, but working remotely, getting together in the mornings to have more sort of editorial meetings and check-ins. And I think to create those sorts of social spaces, it's really, really important. So I think social connection is vital at the moment, and social connection where you can talk about how you're going physically and psychologically, where that's destigmatized. I think Abeer was talking about the stigma. So certainly to have that, to plan your day, to plan what you're doing, because there is so little that we can control at the moment. And if we plan, it gives us a sense of mastery. It gives us a sense of being in control of our own situation. So planning what you can have control over, even if it's something small in your own home, and having a segregation of, at the moment for me, I'm forgetting even what day it is, because I don't have any demarcation of my work day now. I get up, I'm waking earlier than I normally do.
And it's now 11 o'clock at night there, and here you are talking about
Exactly. So I think, you know, and so I'm making sure that I'm demarcating the weekend, for example, because otherwise, you know, work bleeds into my social areas. So I think the three things is social connection, have a plan for your day and what you're going to do, and plan when you're going to do your toughest work. Do that when you're at your most fresh, and have separation, demarcations for yourself. Work in blocks. Make sure you have social time, physical time, because I'm eating more, I'm drinking more, I'm doing less exercise. So making sure we attend to those aspects, because the physical and the psychological are inherently connected. And so we have to address both the physical and the psychological at the same time. Yeah.
I would argue that digital is also intertwined with that, as I'm sure you both would agree, even more.
That's right.
Ever more. So Abeer, from your point of view, let's turn the lens on employers. For journalists who are freelancers, of course, there's a separate set of responses, and I'll get you to comment on that. But for those of us who are working for news organizations and other media employers, what advice would you give to editors, to managing editors, to CEOs at the moment in terms of journalistic safety requirements and what their attention should be on?
Yeah, I got this question a lot because, you know, we have this hotline of Arij that was established 2 weeks ago, and we get
the Arab Journalists Investigative Network, which I'm getting the acronym all wrong for, but
for investigative journalism.
That's right.
And, it's a big network. Currently, they have a new page that we are giving this for around 900 people. So we get this question about how to do with this kind of work. And the thing is that, first of all, don't send everybody to the newsroom. We have heard very early from Australia. I think this was the first infected newsrooms that happen. So it's always better to always keep the people working from home, and it works. You know, you can work from home. If that person can work from home, he or she works from home with different things. The other thing, if they have to go to work, do different shifts. Don't put people a lot in the same shift at work. And of course, the distancing, and I'm sorry, the term social distancing is not very working in some culture, because like it's have a very negative connotation, but like we say, the distancing in the work, if people have to go different shift, sitting away from each other. The other thing that is important is the equipment, because this is an administrative responsibility of the organization, and at the same time, the journalists, because I always advise them to really clean the material again. So they have to provide the journalist with equipment that is already routinely cleaned very well. I mean, like cleaned away from viruses and everything, and train them. And they can still give this online training how to do with those equipments, because in some issues, the journalist, he or she goes by themselves. So the equipment is a big issue here. The other thing that I keep telling them, and I'm sorry to say this, to be ethical. When they send the journalist somewhere, we have some cases, like a case that is now very well known in Tunis, when the newsroom sent a female journalist to a hospital, not accepting the privacy of the people there, and it ended up in a catastrophic way. She seemed she was equipped, but then you see the man, the anchor in the studio, he is asking her to just go and do the interview. So just be ethical and respect the privacy of the people, because, and the other thing about ethical, I have cases about younger journalists who has part-time or freelance contract, who got offer, and I call it unethical offers of the editors, that they are going to give them permanent contract if they do more risks covering COVID-19. And I'm speaking while it's a lot and in different countries. So this is good. And the other thing is not to do cuts, like to cut people out. And you know, because like this own disease, it gets the more weak people elsewhere, they think they're visually, they take women out. So I take every day like cases about women who are really worried to lose their work, because their employer, when they want to sacrifice, they will sacrifice women, especially mothers. On the other half, I want to really praise some newsroom who asked the mothers, or that whoever take care, like in some cultures, men and women, of course, but like in some others, still this has to be enhanced. So they gave some working from home very early, which is something good we have to talk about. So all of those are policies in the newsroom that has to be taken. And I think after COVID-19, now we have realized that not all the work requires that everyone is in the newsroom. That's something that's going to change.
Which may have positive implications for female workers in some countries with caring responsibilities, for example. But until then, as you point out, that's a really cogent point. The people who are most likely to suffer in terms of unemployment because of unethical choices made by employers may include women or others who are in vulnerable situations. So Cait, what would your advice be, particularly focusing now, as much as we acknowledge that all of this is linked, in terms of managing the psychological well-being and instituting policies that support self-care, you know, among journalists? What should employers be doing?
Well, look, I use a term called trauma literate, that managers and editors of newsrooms need to become trauma literate, just as they become aware of physical safety, they need to institute psychological safety. And again, it's not a weakness, it's part of us being human. And I think there is a view in some sectors of society that anything psychological is about weakness, anything about emotion is about weakness. But it's not. It's what gives us richness as human beings. So I think managers and editors need to become aware of what are the signs and reactions, become trauma literate about what are typical reactions of anxiety and depression and stress and burnout. So they need to learn about those as much as they need to know about physical aspects. They also need to understand that some people are, because of their histories, may be feeling more vulnerable. Some people, for example, who have experienced some sort of childhood trauma can't bear to wear anything on their face. So that causes a lot of problems for people that need to, of course, wear masks, face masks if they're going out. So managers and editors need to become aware of those sorts of things, to allow safe spaces for journalists to talk about these things, to create opportunities for the social connection as much as possible. I think that, Abeer, you're quite right about the ethics, because we know that if journalists are being more ethical, they actually feel much more, what's the word? They feel a lot better about the work they're doing, it's a resilience. Certainly journalists feel more resilient if they're being ethical, because they can do a better job. They can attend to their craft in a better way. So I think more than ever, this is an existential disease as well. Of course, it's physical, but there are so many existential issues around this that I think managers and editors need to be aware of, that expand their thinking and their understanding of the broad range of issues that are involved with COVID.
So the whole, we've been calling, many of us who research these issues or practice, as journalists across these issues, have been calling for a very holistic approach that brings together the psychological, physical and digital kind of responses to all manner of risks. So that really underscores it. I mean, if it's an existential crisis and it's of the magnitude that we're describing, then this is that moment, perhaps. Cait, I'm just going to sorry, go on.
Can I just pick up on that? Because if they become trauma literate, it actually enhances the journalism. It gives a different language to the journalism as well. So it's not just about psychological well-being. It is that as well, but it is also about the craft. If you understand what trauma can do, you will understand the communities and the individuals you're reporting on in a much deeper way, and you'll have a language to then put into your reporting, and you'll be able to inform communities in a much richer way.
With empathy, and that goes a lot to source relationships too, doesn't it? So this is really multifaceted. Exactly. Yeah.
That's it.
So let me go to a question from one of the people who's following this discussion now, from Vishal Manv. Sorry guys if I'm pronouncing your names wrong, but doing my best without notice here. And you're in India, based on what you say. You say that 53 journalists in India's financial capital have tested positive for coronavirus. And prior to this, many others also tested positive. But you make the point that media owners are still not offering any support or testing kits So how do journalists cope with this? I mean, we haven't raised the issue of testing kits and the uncertainty that's associated with that. But Abeer, do you want to respond to that specific question?
Yeah, it's a big issue as well, because I mean, I've heard of stories. I said, like, I know personally 7 of them, and one of them is a young mother, and she got it from her work and she passed it to her child as well, which is how serious the situation is. And they didn't agree that she do the test, because the test in some countries is limited to a protocol. It's only done for people who come abroad or people around them in the network. And this doesn't reveal the real numbers of that. But in all cases, this is the time where press unions should really act, because this is how the things is they put pressure on the employers, and people, the journalists themselves, they join together. Because at the end of the day, if you are a journalist and I ask you to do this dangerous mission, to go to this hospital or this village where there is a quarantine around it and there is a big thing, and at the end of the day, you can't say no, because the next person will say yes and you're gonna lose your work. That's how serious is it. But if it's a collective, the power of the collective work, and I mean, if it's not the press unions, and because some countries, the press unions are not doing enough, I mean, the journalists themselves, they have to create those networks. What Cait is saying as well, it's good that we have the internet thing, So this is another thing, and I hope we return back on the online attacks, and the online harassment
we will
increased as well. But I mean, at the end of the day, this question in India, I heard about those incidents. I know how it's severe, but at the end of the day, one journalist cannot stand in front of this, especially now we are all isolated in our house. It's a power of collective things, putting union to action, to work, and to have really strong things. If I'm a journalist, I say, I'm not going to cover this. I have to have a union by my back to protect me.
No, and where those unions do exist, whether they're at the country level or the International Federation of Journalists, you do make a really important point around solidarity, not just social support, but also solidarity on the industrial front. And these are industrial issues, aren't they? And issues with really significant financial risk attached for employers, because if you get injured, in many settings, this requires financial compensation. So Abeer, yes, go on.
I mean, there is this, the problem is this, with this disease, it is happening internationally. So you are not going to get support internationally. And you are not even around the country. You have to get the support right now in the region or in the country you are in. And I think it's a challenge, but at the same time, it's an opportunity for us to work. For example, local media. This is the time, I know the big media might vanish somewhere, might have difficulties, but we have to work more on community media. It's important for several reasons. It's important for the journalists, because most of the journalists come from different cities, come just to the capital to work in the big media. But now journalists, when they are in the big story, is really happening locally. And I think it's an opportunity now to create successful business model for small and medium local media, and try to work from there and put some work ethics as well, in addition to this professional ethics and the work ethics, I mean, relationship with the owners and the journalists.
That's a really important point, but also we're seeing, of course, the significant financial impacts on local and regional media around the world hitting very hard. And in Australia, where Cait and I, where Cait is still based and where I'm from, this was something that was a really early impact of the virus, and we're seeing that repeated elsewhere. So yes, at the same time as there's never been a more vital role for local and regional journalism. We're struggling to be able to provide that service. And I know from journalists who work in local and regional or community context, that what Cait was describing earlier around this sense of whether it's grief or, there's a helplessness there too. Yes, it's our duty, but we can't do it. The people we know that we shop, go and line up in a supermarket queue with, or go to committee meetings with, we can't actually serve them because we no longer have capacity. Let me just take one more question from our colleagues in the audience. So Watik Abbas says, this is a really important point, that today in our country, there is no prevention. And I think that's very true. Apart from the measures we're taking, we can't guarantee that we won't be infected. But there has been a partial lifting of the ban, and I presume you mean there, Watik, the ban on physical distancing, for example, or isolation. and journalists are being asked to go back out, but they don't have the capacity, the protections required to do that. So this is kind of moving forward for some where lockdown is still in place, but for others, including some countries in Asia, and the US is increasingly talking about opening up sections, of course, then we now are in a situation where we have different levels of, risk associated with opening up. So when we do, wherever we are, have to experience this reopening, if you like, where maybe home-based work is being turned off and you're being required to go back into your newsroom, and the virus has not disappeared. How do we deal with that?
It's a big issue, even here in Germany. And I think so far Germany have been managing well with this virus, but people are so worried about the opening up, and they are already starting to develop. And I think this is an attitude thing and a cultural thing and a behavior thing that we have to develop if we don't have the social distancing. I'm sorry to use the term, it's in Arabic, I would never say it that way. But anyway, they are starting to see the cues, the distance. But the problem is with some countries that is overpopulated. Am I speaking about countries like India, like Egypt, like the Philippines, like Indonesia? And I've trained in those countries, Pakistan, and I know it is so difficult to do that. And I mean, at the end of the day, they don't have that luxury. And the issue is that they're starting to speak now about the masks, and the mask is protecting the person if you are ill, to protect the other, and not to protect the other. But if everyone is wearing a mask until we have a better vaccination, that might be okay. But it's a policies, it's a capitalism society, and people now are more worried. And I don't know how you are worried more about not on the lives of the people, but about the economic crisis that we are going to experience, or we are starting already to experience. So we have to put this in the journalist level. And I want to tell the journalists first, it's okay, the organizational responsibility is the country's responsibility, but at the end of the day, it is your responsibility as well. So try as much as possible, if you can take procedures, if you can not share with people, if you can try to do that. And if you can't, don't make others push you into a danger, it's dangerous.
And I think just to I was just going to pick up on that, sorry. Look, I think that's a really important point, because that hooks back to taking that personal responsibility, and even if you're being forced or being pushed by your organisation, there does need to be an element of personal responsibility, of trying to get as much as you can, trying to get your own masks, your own paraphernalia, because that will also hook back into that sense of control. I suppose I was saying before that there's so much out there that we can't control, that if we can at least control as much as possible our own space, our own situation, our own physical protection, we will feel psychologically somewhat better anyway. I don't want to Pollyanna-ish this, but it will give us a sense of mastery, if you like.
Yeah, no, really important points. And let's move now to the to trying to bring in the issues around digital safety and security, which are absolutely bound up with physical and psychological safety. So we've noted already what we're seeing in research, but also just in terms of our engagement with journalists around the world. There is an increase in online attacks. We can certainly say with clarity that includes an increase in targeted attacks, particularly on female journalists and journalists of colour. We're seeing xenophobia and racist themes, for example, very much bound up with disinformation-fueled attacks. And we published research just yesterday with UNESCO and ICFJ that examined these increased risks associated with disinformation, where we're seeing these kinds of attacks mounting. Because when you're, trying to peddle disinformation in the context of a pandemic for whatever motivation, targeting journalists is a key part of that process. So that includes risks around online abuse and harassment, but it also includes risks that, Abeer, I know you've worked in the field of, around digital security, where, you can be targeted through phishing expeditions, if you like, where you're being sent material that's designed to distract you, but also to try and get you to click on links that generate all manner of security problems for your digital communications, which can then affect your relationships with sources. And we know that whistleblowers have been absolutely vital in reporting this crisis around the world, as attempts are made to try to contain access to information or suppress information that's critical of states. So can I start with you, Abeer, and just if you can tell us what you're hearing on the ground from people trying to navigate this huge crisis that we've just described in terms of its effects. These include now, of course, risks around privacy and security and online abuse.
The problem now is that people turn more of their life online. So if we're doing this as well, hackers are working on the other parts. They are trying to really target programs. And you've seen, for example, we're using Zoom. So Zoom all the time has those updates, Skype the same, all of this. So there is this possibility. And I know, of course, because I'm always talking with journalists, so I have cases. I know of the journalists that their Facebook pages were hacked, and Facebook page is a very strong tool for the electronic engineering, for journalists to reach out. It was hacked, and the people who take it want a ransom, so you have to pay to take it back. At the same time, there is the online harassment, which is big already, and Julia, you've been working a lot on this issue, but now it's more increasing. I have cases like, our president of the International Association of Women Radio and Television, Violet Gonda, which is based in UK, but she's Zimbabwean. She has really bad attacks happening against her just because she is trying to bring awareness to the people inside. You always remember, around the world now, there is a capitalist systems around the world. They want the system to open up and people start to buy and sell again because of their businesses, but they don't care that much about the issue of the people. So what she's getting trolls over Twitter, over everything, and they are speaking about things like she's receiving, she's the one who has to have the same treatment of Khashoggi. And for those who don't know, this was the Saudi journalist who was killed brutally.
Hacked to pieces inside an embassy. I mean, so she's getting threats that actually link back to that heinous murder of a journalist.
It starts like this and it ends as an actual murder, like what happened to our colleague in Malta, because it started like that, and it's really increasing. The problem with that, first of all, we want to tell those journalists that they are not alone, so there should be some support system, not speaking only about the families and to support the newsroom. If you work in a newsroom, this is time where they have to do this. Our colleague Greta Gapur as well has done one research about the responsibility of this. And the other thing is that we need more to give them some online courses, some tools online to just protect themselves. And this is the good thing about that. We are seeing a lot of training happening on the internet, and some of this training about the digital safety.
So some really important points there, and the need to ensure that you have appropriate digital security to avoid the sorts of digital security based abuses and attacks, which are usually about trying to breach your privacy, whether that's putting your private information in a public space to try and encourage people to target you physically and digitally. It can be about trying to unmask your sources, so getting into your communication. So these are the times when we have to be extremely vigilant about that, but also where we put all of the things that we've been talking about into practice within our news organizations and within organizations that support freelancers that give us the support networks we need to deal with the harassment as it happens, which, as we know, Cait, I'm sure you would want to comment on this, is a really significant and under investigated issue when it comes to dealing effectively with the problem of online abuse, for example.
Look, it is. You're right, Julie. And I think it gets back to what Abeer was saying before about solidarity and making sure that you create groups, if you're not already part of groups, where if you are under these sorts of attacks, where you can get this social support, when you can get this psychological support, but also where you can get skills as to how to manage this, the strategies to deal with this sort of thing. So again, it gets back to that helping to breach that sort of sense of helplessness, that if you have the skills and the training and the support, those three elements, that it will help bring down that sense of helplessness, that sense of overwhelm that happens when you're being attacked and your security is breached. It's a very personal thing. It's yes, it's professional, but it can get to you at the most insidious level. So it's vital to have that solidarity, those networks.
And it's something that, as you've pointed out, should be considered, perhaps part and parcel of responding to COVID-19. And I'm not necessarily seeing it being incorporated yet in newsrooms around the world, or in fact within networks that support journalists in the way that we are focused on. Obviously, the very pressing need to make sure we're physically safe from a virus.
Look, I think that's true. And I think many newsrooms are still not adept at taking this on, certainly within the Australian context and the Western context. Many newsrooms just say, just report it, or just turn your phone off. Well, I mean, that's just we all know that's not appropriate for journalists, So that the newsroom responsibility is not yet there enough, I think. And we need to have unions and other professional groups to really push newsrooms and media houses to take this seriously as a very important professional issue.
The other actor involved in this, of course, is the technology companies themselves, and the need for them to to be doing more. We're seeing pretty I was going to say impressive, but urgent action on the part of many of the internet technology based companies in response to the disinformation that we're seeing. It'd be fantastic to see some of that correlated with responses that are about defending and protecting journalists, where there's been a great struggle over the past couple of years with people like Maria Ressa in the Philippines, for example, drawing great attention to the need for those companies to adapt their practices to protect human rights defenders and journalists in particular. Would you agree with that, Abeer? And are you seeing any action on that front in terms of what you're dealing with? I'm not sure if your screen's frozen there. I think we've actually just lost Abeer. So Cait, it's just you and I.
Just us.
I was looking at it thinking it's one of those Zoom moments where it's like, she is holding that pose for a long time very effectively. So I'm going to go to a question from our audience. Well, perhaps we try and get Abeer back for the last 10 minutes of our conversation. So one of the questions, I'm just trying to find something, Cait, that you can go to. Now, here's an interesting one. So how do we, now this is Umaima Ahmed, who asks, how can we balance the emphasis on the need to report COVID-19, the disease, and the impacts of the disease, while there are so many other urgent issues going on around the world? The war in Afghanistan continues. I don't know if you're hearing, in terms of the way journalists are framing their experience of this crisis as reporters, whether that's come up, that sense of professional responsibility, having to take your eyes off those balls.
Oh, look, absolutely. I think that at times, not always, but at times is just leading to a sense of overwhelm for a lot of people, because indeed, we've not long in Australia had significant bushfires, but it's like all of a sudden, and there's been a Royal Commission and reflecting on that, but the story is all COVID. There's all manner of other stories that are still happening. Life is still continuing on in other ways. And so I think there's many journalists are feeling a sense of overwhelm of not being able to pick up with stories that they're already in the midst of, because COVID is just taking up airspace and brain space for all of us so much. So again, getting back to trying to, and also the audience. The audience is both hungry for information, but also certainly over the information, I think. And so I think it's useful for journalists and media houses to talk about how to monitor the audience reaction, and when is there saturation, when is too much information, where does there need to be a balance. One of the things that I look for constantly are statistics on recovery, because I get so overwhelmed myself about death and illness statistics, and I sit in front of the TV and I say, just also tell me the recovery. Is simple things. Just please include the recovery statistics as well when you're reporting the infection rates, the death rates, also please the recovery. So thinking more broadly about the story and what is useful for the community at this particular time. I think we're in sort of phase 2 of it. We're not in the acute phase where we're all panicked and feeling that acute sense of anxiety. It's much more of a, well, we know that this is here, it's still present, and we may be experiencing this for months and months to come until there's a vaccine. So there's a different level now. So what does the audience need? What does the community need? So having regular discussions around that, being in tune.
That's an interesting way of thinking about it, that journalism safety also involves a sense of responsibility for your audiences, the communities that you interact with and engage with, who become your collaborators in many acts of storytelling. Increasingly at the moment, we're resorting to user-generated content because of the inability to be in the field. And there are questions around the safety of people we're asking to engage with and to collect material, for example, as well. So those are really important points. And Abeer has rejoined us, which is great.
Welcome back.
We had our classic Zoom moment. So yeah, and you're frozen again, Abeer. I'm going to hope that that is momentary. I'm going to take another question now. So, and this is one that I hope we're able to get Abeer back to answer. But Sheila Katzman points out that Abeer uses the term revealing systems, referring to journalists reporting on people who've got the virus, and not enough reportage on weak infrastructure like healthcare and employment. So I think I'm not sure if you made that point, Abeer, or if that's a point that Sheila's making, but it's a good one. And that is what Cait, you were just referring to, we could describe as sort of a solutions journalism approach to this crisis, where you are able to, if you are able to do your job of accountability reporting, which includes reporting on the systems and the infrastructure, and particularly in light of the recovery phase ahead, for example, what those responses look like to the crisis, not just the facts and figures, for example, about infection rates and mortality rates. Is that something that you think would be valuable?
Oh, look, I think so, absolutely. Because I think that journalists really have a great skill. I mean, journalists are a resilient tribe, we often say. And I think journalists, more than ever, we need really ethical, accurate information at the moment. And so I think being that sort of, I think you used the word before, Julie, that vector of information, but also of, I suppose, getting it.
I'm just going to go.
Hello.
Sorry, Kate, I'm going to hold you up there because I'm worried we're going to lose.
Quick.
Again. I don't know if you heard those questions, Abeer, but say what you would like to say now before we lose you.
No, what was the question? Sorry, because it's
sorry. Yes. So we're just, well, look, I'm going to actually put another question to you, which is one that I suspect only you can answer. And it's from Violet Gonda, who you mentioned earlier, from the International Association of Women in Radio and TV. She wants to know in particular how freelance journalists can deal with covering a story safely where the access to information is limited. So they're working without PPE, for example. But she's also made the point, I think, here somewhere that, or it may have been somebody else, in fact, the way that governments wanting to keep people locked down so that they avoid the sort of accountability reporting that is required at a time of crisis. How would you respond to those two problems? What's your recommendation?
Okay, first of all, I have to really highlight some organizations that is supposed to work, that are already working on this. I mean, Frontline, Freelance, and at the same time, Roripac. So those are organizations that provide insurance for journalists, they provide training for journalists, and they provide one-to-one, sometimes counseling for journalists. And the other thing is that you as a journalist, now this is like your business, your work. You have to protect yourself. You have to know your values. You have to have some training regarding safety, and at the same time equipment. And I mean, here technology is a big issue. As you see here, I'm in Germany, and the network's supposed to be wow, and we see how the line cuts. So it's
we're all zooming, so yeah.
Yeah,
Yes.
I don't know what's happening, but really it happens. At the end of the day, have the right equipment, have the right training, put your protection before anything. What I would say to war reporters that I've been training in the Middle East and beyond, that at the end of the day, when you make risks, you can end up with a problem like being handicapped about something, and then no one will employ you. So it's not about your recklessness to get killed or something. It can leave something permanent for you. So risk management is a key for everyone. Everyone has to go, not only to do the training, because I need people who knows the information. It is time to apply this information. And at the same time, join unions, because unions is the one that really can protect journalists. And I mean, even the smallest one might be the more effective one.
Just one more question, which is very practical in terms of its, well, hopefully in terms of the answer as well, but reporting in environments like slums, and that's the word that's being used by one of our audience members around the world. You know, if you, vast populations who depend on journalists to, you know, do the sort of reporting that that is focused on social justice issues, require journalists to make physical contact, to go into those places, because I suppose we see an additional level of isolation for those communities where there is less capacity to be digitally connected. But so you have the two-pronged problem. You have the problem of going into those environments where the people are living in closely packed circumstances, so the risk of physical infection exists, but also where you have the problem of trying to report on communities that might be digitally distant and unable to participate. So how do you have any advice on that, Abeer?
Yeah, maybe I say maybe they are overpopulated, but you know.
Now we've lost Abeer again.
Sorry?
We lost you for a moment. Keep going, Abeer.
Yeah, I promise to stay. I try my best. So the thing here is that what I would say to the journalists, for example, in some countries, they do a quarantine for a village. Then this village is completely closed. Even if you are a journalist, you can't enter this because of the curfew or whatever. So what you can do here, and the cases here, is to try to speak with them with the available technology. In some African and Middle Eastern communities and all over the world, there is the WhatsApp groups. This is very common in many countries. So try to make the person use the technology he or she already has. If he can't do it, he can get his younger son and daughter. Those overpopulated communities are young communities, and young communities use technology, even if it's on. The issue is the trick here for the journalists, and I think some manuals, new manuals like the one with the CPJ and the other highlighted and open media hub, to give clear instructions for the people to send you the material. If they can't do video, just tell them how to do the video. Or if they can't have it, because of course they don't have the best internet, try to do it audio and try to coop. And this is when the journalists become a mentor or someone to tell clear instruction, and try to be nice and negotiate, because at the same time they want the voices to come here. And we have seen on the internet, you can go and Google on the internet and use the electronic intelligence for your site, electronic engineering in your site. See in this community, do the proper search and know who lives in that place. Try to communicate with them, get hold of them, and let them tell the story according to you. The people in quarantine, for example, if I can't go and interview someone who got COVID, what do I do? Those people already, you know, even if they are in intensive care, we've seen a lot of videos like that. So people reach out. What we need as a journalist to reach the right people in, and we can do that. A lot of journalists already, and I'm sorry, but like, they don't all grow up in the nicest places, but they can be already from those slums or know someone, a colleague or someone who is there. Those people are very cooperative. And we already have seen a lot of excellent stories that was published in the last few weeks.
Yeah, I think those are really good points, and they go to the issues of you know, being able to be innovative in the ways we report and engage with our communities that also keep us safe, which of course is the vital message of this session. We're out of time, but I'm going to come back to each of you just to wrap up perhaps with a message about preparing for the future, you know, given that this is, I mean, Cait, you made the point that we're past perhaps the urgency of the crisis and we've moved into a next phase. I think that's true in some countries, but in places like the US, it's still very much, you know, approaching a peak. And so there's these different, you know, needs around the world as well. It might feel like, you know, it is a pandemic, but it's, as you've pointed out, Abeer, it's a staggered one. So just before I do that, though, I'm going to point to some resources, and Abeer, you've mentioned some of these, but some organizations and their websites that it would be great for people to be familiar with if they're not already. Committee to Protect Journalists, Reporters Without Borders, Reporters Sans Frontières in French, RSF is the organization. There are organizations like the International Press Institute, of course ICFJ has its resources, DART has its resources, UNESCO has many resources connected to journalism safety, especially around freedom of expression issues. And Abeer, the ARIJ, which you mentioned, and the International Association of Women in Radio and TV are just a few, and many of those websites have free resources that do exactly what you've described, Abeer, in connection with various acts of journalism that give you step-by-step tips and tools. And we have IJNet at ICFJ that does a very good job of trying to disseminate that knowledge. But to come back to you to wrap up, and I'll come to you first, Cait, just if there's anything you want to say in conclusion about what you think would be useful advice and support for journalists participating today.
Sure. Yes, look, I would, it's the thing that Abeer said about knowing your values. I think there's a thing we know about now called moral injury. So an injury that happens because of our moral compass as being breached. And I think many journalists may feel this with governments making particular decisions that they may not agree with, that are putting the community under even more threat potentially. So one of the things that can really enhance the resilience of journalists is knowing your own values, your own sense of ethics, your own moral compass, and staying true to that. And with that, making sure that you join in solidarity with others and have opportunities to talk about those ethical issues, because there are many significant ethical issues that are out there at the moment, and the potential for those to be breached. And it will enhance your resilience if you have a true sense of values and ethics. So I think knowing your own values, having your own solid moral compass, and solidarity and social support are the two things that will really enhance people's resilience in covering this issue. Great,
thanks. And other people have been pointing out that we've mentioned this as well, that Rory Peck is an organisation with its own resources, along with the International News Safety Institute, INSEE. There are many of these, the Ethical Journalism Network, to name another, and the World Association of News Publishers. We could go on. Just to say, we're going to put those resources on our website, and we'll include them in the piece we write wrapping up this webinar. We will also come back to other seminars where we focus very deeply on digital safety and security as a specific issue, and answer to some questions from people about how to defend themselves against state-sponsored hacking, for example. But to wrap up, Abeer, can you share with us what your key message is on staying safe while reporting COVID?
The first of all is that your safety, the first barrier here is your own boundaries. So you are responsible of your safety. The issue is that we always think as a journalist that bad thing happened to the others, and then we don't think it will happen to us. No, it happens to everyone. So that puts this, I mean, at the end of the day, it's your attitude, it's the distance you keep. I keep hearing things from journalists who has a problem because, you know, in some cultures, if you don't come that close to the person and speak with them, it's bad. But you know, the behavior of whole society is changing, and you as a journalist, you have to change as well, and you have to think about your safety, your equipment, clean your equipment before and after. Try to have innovative ideas and tool equipment so you don't touch the person or this equipment is in a far place with this. Try to know your rights as well, because I think knowing your right will help you, especially if we are really approaching this economic problems where we know that there are going to be some sacrifices among us as a journalist. We are not going to accept that. So we have to fight back. So we have to be knowledge of what we want. We have to prepare this from now, because we have to be campaigning not only against the disease, but for ourselves. But last but not least, this is a big, colleagues, this is a big opportunity for local and regional media, local media. If you want, and some of them have done that already, return to your local community, start thinking of a good business model and I'm sure it will take you to the next level.
It's an inspiring and positive way to end the conversation. And with the Tao Center at the University of Columbia, we are we have just launched a study which will go on for the next year, examining the future of journalism in the time of COVID-19. So hopefully we will be able to come back to these issues and more. And it's been fabulous to have a conversation that's been so multifaceted with you both. Just before I finally wrap up, a note that if you've participated in this webinar as a registered participant, you'll be sent a survey, and it's really important for my colleagues that you fill that survey in, just so that we can make sure these webinars are serving your needs, which is our absolute primary goal at this time. So Dr. Cait McMahon and Abeer Saady, it's been a privilege to speak to you both. Terribly informative and lots of practical advice packed into a discussion that also was really thought-provoking for me, and I'm sure many others. So thanks again, everybody, and we'll see you, the community of ICFJ and IJNet reporters who are focused on COVID-19. We'll see you online and continue to serve you with these webinars, and also a whole host of other resources to help support you through these incredibly difficult times. Thank you very much. Stay safe, everyone.
Thank you.
Thank you.
Thank
Bye.
you. Bye.
Thank you.